John DiMaggio and the team at Tulsa Spine and Rehab deal with a wide range of injuries, each one requiring a specific course of treatment. Dr. DiMaggio, what unique challenges are presented for a soft tissue injury?
It's a little different than something of the, osseous structure, like meaning with a bone, and a little different than, when you're addressing a motor pattern or something like that where the patient has a neurological deficit. So typically with a soft tissue injury, a very helpful piece of information when you're taking the history from the patient is finding out their mechanism of injury. So I was running, came up lame, I was grabbing my hamstring, or I tripped, or I fell, or I do this activity and it constantly hurts afterward. Or even when I'm resting, it hurts, or this period in my workday. So we look for a certain clue to kind of cue us into, A, what triggers the problem, and then B, what kind of aggravating factors or, relieving things even in that case. Does heat help? Does ice help? Is it relieved by medication, stretching, rest, exercise, So once we figure out based on their history and kind of what they're telling us, it helps dictate sort of where we're going to take that treatment.
So are we mostly talking about pulled muscles or what other kind of soft tissue injuries might we see?
Soft tissue in a nutshell involves the muscle, the fascia, so the connective tissue covering of your muscles that help them work together as groups. So like your quadriceps, for instance, 4 muscles separately, but when they contract, the fascia helps them contract as one unit so you can put out a lot more force. And then lastly, ligaments, and some people will consider nerves as soft tissue. And so there's some nerve entrapment type release, things you can do as well. There's specific techniques for that alone. But typically in our office, we're dealing mainly with strains of muscles, sprains of ligaments, and then fascial distortions or fascial distortions like we've maybe podcasted on before. And that's just injuries to the fascia itself, the connective tissue covering. So those main 3 things, fascia and then sprains and strains of muscles and tendons and ligaments.
You went over some of them or a little bit earlier, but what are some common treatment options when it comes time to address these issues?
For more like a regional approach, massage therapy, deep tissue in particular, is fairly efficient. It helps kind of address the fascia. It's kind of like a broad stroke, if you will, if you take a paintbrush. And then some of the things I do will be more like a small or fine tooth pin. So we're kind of working on a particular muscle or a particular part of the fascia. A lot of times the tension or the stretch or the active care or things that we're doing in here is an adjunct to what we're doing with the soft tissue. So if you have chronic tightness in one area, it's usually because you have a compensatory reaction. So you're weak in another area and it's causing, more often than not, we'll see this in the upper back and traps. People are weak in their neck flexors and neck stabilizers. So the upper back muscles are overworked and they're knotted and they're tight and they're just demanded. So we'll kind of attack that with some of the soft tissue that I do, some of the soft tissue that our manual therapists or massage therapists use. And then counter with that, some exercises. Patients typically see a better outcome than using one alone.
Sounds like one of the key components to a treatment plan is really spending some time investigating, what has triggered this or what works, that sort of thing. So you probably spend quite a bit of time just sort of helping the patient sort of find out the causes and that sort of thing, right?
Yeah, and that's, essentially day one is just hammering out a lot of questions. Like I was talking about, mechanism of injury. And then as you're treating the patient, sometimes the treatment is the assessment. So you find out what they can and can't do, either with the functional test to screen maybe core strength or glute stability, stuff like that. And then same thing with soft tissue. We're trying to figure out, sometimes you just have to get in there to assess the tissue manually and see, yes, this is what they feel, but also this is what I feel. And then you kind of mash the two together to really zero in on what's going on.
The team at Tulsa Spine and Rehab has the expertise to address the aches and pains plaguing you. See how they can help. 918-743-3737.